Communicating with family and caregivers. Family and friends and other people in the patient's life, such as colleagues, neighbors, and acquaintances, are often central in supporting the patient through diagnosis, treatment, remission, disease progression, and end-of-life care. Family and caregivers are just as invested in the patient's care as the patient themselves, and they experience similar or higher levels of distress than patients. Often, they play a large role in decision-making processes and sometimes have quite different emotional and informational needs, as well as wishes or preferences compared to that of the patient. Family and caregivers may also have different opinions and perspectives to the patient. Family disagreement and conflict is rated as one of the more challenging of communication tasks for clinicians. When working with families, it is important to adopt a family-centered or caregiver-centered approach to communication. This includes clarifying the family and caregiver's relationship and role in caring for the patient, acknowledging the importance of these supports, and emphasizing their positive intentions in caring for the patient. Additionally, praising and commending them for their efforts. Regular and proactive family meetings, especially when the patient is unwell and in the ward, may be very helpful in addressing families' informational needs. The aim is to reach a common ground and come to decisions that are in the best interest of the patient. These are some of the recommendations for conducting family meetings. First, setting up the consultation. Clarify and respect the patient's preferences for who attends from their family. Greet and welcome the patient and the family. Conduct introductions of all attendees. Clarify the nature of each family member's relationship to the patient. Check understanding. Check understanding of the consultation, current illness, prognosis, or goals of care from the patient and each of the family members present. Be clear of wanting what is best for the patient. Clarify preferences for information. Check the patient and the family's preferences and willingness for information. Providing information. Where necessary, provide information and facilitate discussions of current issues. Directly ask each family member their opinions and concerns and ask for their reflections on their family members. This helps clarify differences and encourages better understanding, acknowledgement, and alignment with each other. Encourage shared deliberation and problem solving. Normalize differences of viewpoints and avoid taking sides. If the patient is not attending the meeting, inquire about the patient's values and their likely wishes in the situation. Facilitate reflection on discussion relating to the decision-making choices, but defer problem solving to the family as much as possible. It can help to summarize any differences of opinion between two or more people, clarifying reasons for these differences, but leaving resolution of these differences to the family. Aim towards consensus between family where possible. Provide clear medical recommendations where appropriate. Suggest a plan for priorities of the patient's wishes. Check understanding of the information discussed. Check understanding from the patient and the family. Respond to emotions. Inquire about how the family are coping and feeling. Emphasize the family's strength, commitment, and support of each other. Summarize the consultation finally. Recap the discussion, concerns raised, agreed outcomes, goals of care, and follow-up plans. Seek consultation from others. Consider referral and follow-up with the family as required. Following these steps can assist in conducting meetings with patients, families, and caregivers. Effective communication, involvement, and support from the family and caregivers is essential to good patient-centered care and outcomes.